Good afternoon, everyone. Mayor Marotta here with Deputy Mayor Ed Charamut.
Thank you, Mayor. Good to be here this afternoon with you and the Health District, the Central Connecticut Health District.
Yeah, and so we
Charlie
have
Brown.
Our very first guest today, Mr. Charlie Brown, and we're so delighted to have you here. You know, the council has been very big on trying to find new ways to communicate with the residents, and now that we were fortunate enough to get a grant for our IT department, we have a lot of new gadgets and gizmos here, and so we're really excited to have an opportunity to speak with the residents more on a regular basis if we can.
Sure, I think one of your initiatives, Mayor, when you first came in was to improve communications for the town, and this equipment will clearly help us improve communications from the town out and from the citizens back in. So this is great.
Yeah, and hopefully at some point we can make them interactive, so if we have questions, we can have the audience ask questions. But so Charles, thank you again for coming and speaking with us. I guess with things changing a little bit now with COVID-19, we wanted to have you come and just speak a little bit about expectations. I know people are getting a little anxious about Halloween coming up, and I see the CDC has some guidelines. The state doesn't necessarily have restrictions per se, but they are following CDC guidelines. So we thought it'd be a great opportunity to let parents know, what are some of the good things to do, maybe what are some of the more risky things to be doing. Maybe we can start off with Halloween and work our way into what's going on.
Boy, Halloween, how do you do that?
Yeah, well, Halloween is a challenge, to be honest with you, because some of the things that we've been trying to keep everybody from doing is exactly what you want to do at Halloween.
Right.
You want to go and interact with a lot of people, and for the kids, it's interaction equals candy. So from a public health perspective, though, in the middle of a pandemic, that's not the best idea. So CDC and the Department of Public Health have listed trick-or-treat events and trunk-or-treat events as both being high risk. So, we really want to, make sure that if people are going to take advantage of these types of activities, that they're doing them in the safest way that they can. Making sure that they wear a face mask. So the mask that comes with the costume is not necessarily the same type of mask that you want to have to protect yourself from COVID. Mm-hmm. So making sure that you're wearing an appropriate face covering to protect you from the disease. Making sure that you have the appropriate ways to sanitize your hands, and really think about, if you're going to be handing out candy and handing out treats, on how you can do that safely and effectively. So maybe bagged treats and not individual treats. Putting things out where people can take them without having that person-to-person interaction is another good example. And the State Department of Public Health has some good guidelines on their website. I would encourage anybody that's thinking about going out and doing trick-or-treating in the traditional way, please take advantage of the information that's on there. They list a lot of good information there, taken from CDC as well, to really help you do this safely.
Yeah, that's some really good advice. I know that we've been hearing a lot on the news now about Thanksgiving too, which is a little bit confusing for folks because they're wondering, I can...
Charlie, I'm kind of thinking with Thanksgiving, if you know your bubble, the people in your bubble that are getting together at your household, maybe you can at least have a semblance of a family Thanksgiving. No?
Yeah, and I think that what we're asking people to do is to keep that a small bubble and not a large bubble, because every person that you add is adding another interaction, another potential exposure to the disease, and another potential spreader if somebody at that function actually was confirmed as a case. So, we want to be able to celebrate and give thanks for everything that we have, but I think that we really need to do it safely, in a more inclusive manner than what maybe we have done in the past, just to assure that we're not causing people more grief than we're giving them the opportunity to say thanks.
Yeah, I think that bubble is the bubble is only as good as everybody in that bubble is honest with where they've been and what kind of contacts they've had, and they're not suppressing an event just in order to be there, If you need to take yourself out, take yourself out.
Yeah, and even within that bubble, I think it's important to, continue to do the right things, by washing your hands, by watching your distance, and wearing a mask when you're not eating and you can't be socially distant within that setting. A lot of the disease spread that we're seeing right now, even at the end of the summertime, is really being driven by small family gatherings, because people feel comfortable, and they're much more likely to not adhere to those precautions in that small setting. So it becomes even more important when you're in with your family and comfortable to really think about it and say, okay, I know I want to give grandma a big hug and a kiss, but it's not necessarily the right time to do that if you've had other exposures.
And I think that's probably what one of the reasons why you probably, if you can, avoid having the traditional Thanksgiving this year, because I think everyone has the best of intentions going to someone else's house or going to grandma's house, but you find yourself in that situation, you're full, you ate a lot of turkey, and all of a sudden you let your guard down. And I know traditionally we will go through all of the newspaper ads and see what's on sale for shopping, and you just start doing things really close to one another and not recognizing the
spontaneity
risk.
of it, right?
Yeah.
When it's spontaneous, and families, hugs and kisses. It's a lot of pressure to reciprocate and to do that. Do that hug. Really, it should be a hugless Thanksgiving.
Well, I mean, as within your own family, I think that's one thing that you do when you start to get out into the extended relatives. That's where I think you become a little bit more challenged. And trust me, I'm a big hugger. I mean, that's the way I was raised. So this has been a real challenge for me personally, to be able to have to restrain from that type of activity.
Yeah.
But I think that we're at the point now to where we recognize that it is adherence to those protocols, adherence to those prevention measures, is really what's going to keep this thing from spreading as fast as it will. It's a very opportunistic virus. I've said that many, many times over, and it's going to take what opportunities that we give it. So the less opportunities that we give it, the less chance it's actually going to spread within the community and to impact our families individually.
Let's assume that this pandemic is not traditional virus type, but in the traditional virus mode, right? There's the first wave, then there's the second wave, which everybody told us would happen, and it's now happening, a couple weeks into it, and the third wave.
Yep.
But is it true that the second wave and the third wave, they're smaller?
It all depends. I mean, it really depends upon the actions that we take. I mean, we don't know how big the second wave is going to be, because we don't know if we're going to take the same actions. We took very drastic actions to really cut off the second wave. It wasn't a natural exponential curve, so to speak, because we didn't let it ride itself out. We took action. We closed off the state. We all were mandated to stay home, and that's what brought those numbers down, in a very effective way. So whether or not there's enough people out there to have spread the disease in a meaningful way, we may see a very similar wave as what we saw in the spring. We may see modified based upon what interventions that we have in place and what we can put in place. I think normally when you talk about the descending wave effect, it's because the first wave you hit a lot of vulnerable people at first, and then the second and third waves as they come in, there's less people that are vulnerable to that particular disease within the population. You start to see the effect of some herd immunity, which helps lessen the degree that you can actually people within the communities can get it. So it is something that we have to be very cautious about, and I think that as we go into the fall, as you mentioned, we're in the fall surge already. So trying to be able to make sure that, people adhere to the protocols that they have is very, very important.
Which brings up a couple of interesting topics. One is the new governor's executive order, which essentially gives municipalities a bit of more discretion. And then second is the flu clinics, right? Because that's going to tie into what's happening in the viral world. So, did you have any specific question about the executive order?
You would be referring to, I guess, Executive Order number 9G, and I think you did cover it in our last public safety meeting, but it does kind of give the responsibility and the oversight to the local municipalities and the local health district to kind of be aware of where their numbers are with regards to 100,000 person population group.
It's a case rate. So where Rocky Hill doesn't have 100,000 people, we look at the number of cases per 100,000 as a level to be able to say, how would we compare against other towns? So it's the ability to compare how big of an impact that disease has upon our community and other communities around us. It is very important, I think, for all of us to be, monitoring those numbers. As we've seen in the health district, we are seeing those numbers increase week by week. So we're, on alert for those things already. Actions based upon whether or not we reach an alert level is really, as you mentioned, a individual, town decision at this point. I'm not sure if it's going to stay that way, and that's speculation. But at this point, I think we work very closely with our towns, with town leadership, both at the mayor level, town manager, school districts, to really take action that's in the best interest of the community. And we'll continue to do that based upon what numbers that we see. The challenge with Executive Order 9G is that you have 96 hours from when a town hits that alert level to make a decision as to whether or not you're going to roll back restrictions from one phase to another. And, it's challenging because, some of the things that we have to do to be able to roll back will take significant effort to do. So I think that some conversation and some thoughts within the health district already is it going to be worth the effort to try to roll back regulations on restaurants, for example? Or do we spend our limited resources in trying to get people to understand the need to, adhere to those personal restrictions that really keep the disease from spreading further?
Yeah, I think that we would like to see communication. So
absolutely.
If the restaurant community and the community at large could understand that something's moving to the negative, increased cases, we ought to let them know so they could die down their activity. If things are good, it's a cautious good, type of thing. But it's going to be, I think, coming down to communications.
No, absolutely. And the challenge that we have is with each individual town having the ability to really bring things back, how effective that's going to be in a state as small as Connecticut. Because if we roll restrictions back, to phase 2 within Rocky Hill, but the next town is still in phase 3, people are not going to respect and stay in their town. They're going to go to the place that's going to allow them to do the things that they want to do. And that's just really going to spread that disease and spread the impact from one town to the other.
Well, that's an interesting point. Is there any chance of moving as a district in?
We can talk as far as with the 4 towns, and we are looking at things at a district and a town level. So, the only thing is that with the state, the alert, it only allows individual towns to act as they reach that alert level. My honest opinion is that, our towns are not that different, and they're very close. So we're going to start to see over the next few weeks so many towns, I think, that are going to hit the alert level that it's almost going to become untenable to do this in an individual town-by-town basis. That we may be getting into the position to where the state has to take action on a regional or statewide basis, just to assure that we don't have that difference in application.
And I think too, just so folks are not panicked, right now, the new data system that the state has out and the new, it's color coded, you know, gray, yellow, orange, red. And when you get into the red, you then have that discretion to move from phase 3 to phase 2. So it's not as if we're talking about, oh my goodness, we're now in red and we have to completely shut down the state again. It's sort of this stage by stage.
Look something like this.
Yeah. So hopefully it is a matter of just getting out the word that we cannot become complacent, and that the most important thing to do is wear the mask, social distance, and wash your hands, because that's how we flattened the curve last time. And so we know that that works.
Right. I mean, and it's amazing. Public health is not rocket science by any means. You know, it's really simple, common sense, practical things that you can do to prevent the spread of disease. And we've shown like you said, just in the springtime, that these things can work. That if we do keep our distance, wash our hands, and wear a mask, that we can slow that spread of disease down to manageable numbers. The challenge that we get into right now is with the hygienic fatigue, and with coming into the holidays, the real challenge of, you know, not recognizing the risk that, you know, those gatherings and everything really present. So, you know, it's, I think, going to be a matter of repetition, and communication is always that way. We're all going to have to be a choir singing the same tune, so that everybody can get the message and follow through with it. Follow through is the most important part.
You know, Mayor, around town, I've noticed, I don't know if you have, but it seems like folks have moved outdoors quite a bit, and even for the fall. So instead of inviting people into your kitchen, where everybody wants to stand in the kitchen, you know, you're seeing more of the backyard fire pit or the backyard picnic, where people actually have that freedom of that elbow space in a more natural, it feels more natural to be 6 feet apart when you're out in the back patio than it does in your kitchen.
No, I'll agree. But I mean, even with that, we've heard anecdotally of, you know, the large picnics in the backyard, where somebody's trying to pack 50, 75
sure.
people.
That's where you got to fight back the urge to invite that extra person and that extra person, and
Yeah. So you really have to be cognizant of that, you know, that limit and the number of people that you can really manage. So there are limits according to the guidelines and the reopening guidelines just for outdoor events as a whole. So be cognizant of that. You know, and I know people want to celebrate accomplishments. They want to celebrate the holidays as a whole. But this year, I think the time is to be a lot more, you know, tight in our invitations. You know, definitely share greetings and things of that nature, but a greeting shared via a card is, you know, probably the best bet this time, because very little can be spread that way.
And so moving into flu season, this is it's a little intimidating, but
Thanks,
you know,
Mayor.
you hear that you know, some of the other countries are not experiencing a terrible flu season, that it's relatively mild. I don't know if that's still true today, and that somehow that comes into.
Yeah, I think that a lot of the precautions that we put into place for COVID-19 have had an impact upon, you know, the spread of flu, because they're the same precautions that keep you from spreading any type of respiratory disease. So we see that added benefit, and they saw that in the Southern Hemisphere during their flu season, that they saw very little flu. So I've said before that I think that we have the opportunity to have one of the healthiest school years that we've had for some time, because a lot of the, you know, people are adhering to protocols that in the past they might have said, oh, I'll give my kid Tylenol and send them into the class because I have to go to work. Now they're much more cognizant, and they're following those protocols, you know, more to the letter. And I think that the school systems are doing a great job when people do develop symptoms of getting them out of the setting, school setting, isolating them appropriately, and then bringing them out back home to where they can recuperate. The opportunities that we have to really interact remotely are things that we never had before. So, even if we're not able to attend something in person, we can Zoom and still participate and be productive in that manner. So I think a lot of that's had impact on the flu season as a whole. And we're still doing the things that we can to limit the spread of flu as well. We're going into our 4th week next week in our flu clinics that we do every year. We're doing them a little bit differently this year to where we're actually doing drive-through clinics, which have been very successful. So we've actually had quite a few good numbers coming through and getting their shots driving through. And our volunteer nurses have been doing an outstanding job in vaccinating in that setting. So it provides an opportunity for us to really protect ourselves from that well-known infection, and be able to protect our communities and the hospital resources especially from having to deal with both COVID patients and with influenza patients. I'll bring one statistic in here for you. This week at the beginning of the week, we were actually seeing the percent of ICU utilization was up into almost 80%. So we don't have a lot of capacity in those ICU units for additional cases. So we have to be very careful on what we do, because as those resources become overwhelmed, it is where we really see a lot of mortality start.
So is that 80% a statewide rate?
80% within the region. So, we're lucky in the Hartford area because we have several hospitals that we can go to. So that average rate across Hartford at the beginning of the week was close to 80% ICU utilization.
Okay.
Mayor Marotta, I was wondering about nurseries. You don't really hear much about nurseries in the news. I mean, we know about assisted living and nursing homes, but the nurseries are open, and school is open, and people are back to work, and nurseries have been doing a good job, I guess.
Yeah, I mean, I think that overall they have been doing a good job. We've been working with a lot of the daycares and nurseries to assure that they have the appropriate protocols set up to both exclude children that are sick, and then what to do if they do have a positive case, how they can do appropriate contact tracing and isolate and quarantine effectively. We've been lucky. I think that overall we've had a few cases where we've had to shut down a particular daycare because they just didn't have the ability to assure that not everybody was in contact with a case. But aside from that point, I mean, I think those instances have been rare. So they've been doing a very good job in being able to stay open and still service their population.
That's good to hear.
So I think moving into the colder months, we're in good shape right now, district-wide, right? Good shape in Rocky Hill, and it really is just a matter, like you said, of being cognizant that the virus is still here. It hasn't gone away. It's just our mitigation strategies that have helped tamp it down. So the key is really just to continue those personal mitigation strategies so that we can get through Thanksgiving, we can stay open, we can get through the holidays, and come out in the new year, hopefully with a vaccine. And
that would forward. Be a great thing. And I think that they're working very hard on a vaccine right now. I think one of the questions that I get quite often is, when they get a vaccine, is it going to be safe? And I think that the system's in place to be able to make that a very safe process. There's a lot of talk about fast tracking things and is it going to be the safest way to accomplish this? I think the fast track is not in the clinical trials. It hasn't really impacted that function of it, but in the production of a vaccine once it makes it through there. So being able to invest money at a government level to be able to allow for them to take the risk out of a vaccine manufacturer's decision of, am I going to move forward with a vaccine that is still being tested, has really allowed them to step forward, because we're taking a lot of that risk out of the equation, the financial risk. So, if the vaccines make it through those clinical trials, you'll see me. I'll be one of the first ones to stand there and get a vaccine.
That's great. We'll
Sure.
have to film that.
Yeah. So on the vaccine,
Y'all can line up.
on the vaccine issue, though, is the virus, or is it not evolving? You know what I mean? Changing its structure. I've always heard that it
Mutating?
changes to a weaker state over time. And if it changes, will the vaccine that they're producing work for the new strain of this?
And it's very similar to what you see in flu, to where you have influenza as a virus, but it's a very different strain every year. And every year they have to adjust the vaccine to deal with what the anticipated strain is going to be. I think that that's what's going to happen with COVID, because the virus itself does continue to mutate, not necessarily to become weaker, but to take advantage of things that, are an advantage to it. So generally we see viruses become better at infecting people and not worse. Sometimes it does turn the other way, like in the Middle Eastern respiratory syndrome. It actually turned away from humans as a reservoir and actually moved into other zoonotics. But I think that that's going to be part of the game that we play in the future, is what's the strain of COVID that we're dealing with right now? This may become something that we have to be vaccinated against, multiple times. It may become just like the flu, where it's your annual COVID and flu vaccination that you receive.
Interesting. Well, I want to thank you so much for your time. I think we've taken up at least a half hour of it. We know that you're super busy, and we appreciate everything that you do for us and that you do for the district. And we want to just say thank you officially to you for everything that you do.
Thank you, Charlie.
You and Lewis and your whole staff.
No, you're very welcome. My staff is the ones that are out there really doing a great job. Our staff and volunteers really are proud to work for our communities. And, thank you for the recognition of that.
You're welcome.
It's very important.
You're welcome.
Have a great afternoon.
Thank you so much.
Y'all too. Take care.
See you soon. All right, everyone. Well, I think that was very informative, and we thank Charles Brown for coming, and we're going to try to continue to do this pretty regularly as topics come up.
And I think the main thing is that we're staying connected through all of this. The town is staying connected. We meet regularly and we talk regularly, so communication, I think. Absolutely, because not everybody watches a town council meeting. Not everybody, goes on social media or checks our website. So it's just another avenue. We don't want to necessarily always mail things out because it's very expensive. But it is, especially with the pandemic occurring, now that we have new technology and availability to reach out, we want to just do that. So we'll do that through public access. Great, thank you.